state health leaders announced the largest one-day total of COVID cases in Indiana since the start of the pandemic. 12,937 cases reported on Tuesday. It's a lot more than the second highest day of the pandemic, which was just a week ago. And this morning, a teen is finally home after spending months in the hospital fighting COVID. 16-year-old Wesley Fox caught COVID along with his mom in July. Both of them were unvaccinated. At first, he says he remembers not being able to taste anything. And not long after, he says he was in the ER struggling to breathe.
We had several calls with different doctors in that time of, your son's probably not going to make it. This is our options and we don't know if they'll work.
For 8 days, Wes was on an ECMO and spent 160 days on a ventilator being cared for at Peyton Manning's Children's Hospital. In October, he started showing signs of recovery. Like so many, Wes didn't think his case would be so severe.
I thought I was healthy enough that even if I did catch COVID, it would just be like a cold and then I would bounce back from it. But here we are, 6 months later.
Wow, now he is just grateful to be alive, reminding others to take the virus seriously. Wes will re-enter rehab until he gets stronger, hoping one day to become a registered nurse, just like the ones who cared for him. Well, just the last month, about 176 kids across the state were hospitalized. More than a third are in the youngest age group, Hoosiers 4 and younger. The rest are between 5 and 19. That's 109 kids in just the last month. And children are also the least vaccinated group in the country. That's generally the case in Indiana as well. And a CDC Vaccine Advisory Committee voted to recommend expanding Pfizer boosters for ages 12 to 17, at least 5 months after the primary vaccination series. The CDC says vaccinations among 12 to 17-year-olds has slowed recently, but there are still quite a few questions about how the booster interacts with other vaccine teens may need. So our Verify team found some answers.
Verify here with your Fast Fact. The CDC gave emergency use authorization for children 12 to 15 to get Pfizer's COVID-19 booster shot. Since it's also flu season, one Verify viewer asked us, can teens get their flu shot at the same time as their boosters? Let's verify. We checked with these sources to explain the latest guidance.
The current recommendation is that they can, and that it is safe and effective. So giving multiple antigens or vaccinating for multiple illnesses is a long-standing and common practice.
This is consistent with existing CDC guidance that says it's okay for adults to get both their COVID-19 booster and flu shot at the same time. So we can verify it's true. A teenager can get their flu shot at the same time as their COVID-19 booster shot. With your Fast Fact, I'm Brandon Lewis.
Well, the Indianapolis Children's Museum will host a vaccination clinic today. You can get your child as well as yourself vaccinated against COVID. They'll also have boosters and flu shots available from 4 until 8. Shots are free and you don't have to pay to get into the museum to get those shots. But if you'd like to see all the Children's Museum has to offer, they'll have a discounted price of just $6.